Okay, so let me introduce myself. I'm not sure how many of you already know me. So my name is Samira Bhatti. I'm one of the chiropractors and I work at Spire Bristol. I did a talk this time last year when I came into the office. I'm not sure if any of you were there attending that talk, but Natasha's organised it again this year. As you may not be aware, is the Back Pain Awareness Week. So it was just kind of, Natasha wanted to just for me to have a little talk again, because obviously during the pandemic, everything has changed now. So a lot of you are having to work from home. So your ergonomics and your posture has changed even further. And that's probably having an impact on your back and your neck. So we just wanted to kind of, she wanted to just for me to highlight and give you some top tips really, just to help you prevent some back pain whilst you're working from home. And if there are any of you that were suffering from back or neck pain and wanted to have a little chat after, then drop me a message and then we can do that. So let's get started. So I'm just going to share my screen with you all. Let's talk about your spine itself first of all. So as you can see, your spine is made up of a lot of the vertebrae. So you've got your top of the neck all the way down to the lower part of the spine. So this is looking at it from the back, this is looking at it from the front, and this is looking at it from the side. So your spine will load slightly differently depending on how you're sat or how you are loading your spine. The research actually suggests that the most loading that takes place is during sitting positions. And again, that would determine how you are sat down, which is why the ergonomics and your posture plays a massive part in that. Space here is the space where you have your nerve roots coming out from. So these yellow bits here, these are your nerves. So they come out from this little foramen here on each side of the vertebra. So again, depending on how you're sitting, so for example, if you're twisting to the side or if you're bent, that will have a knock-on effect onto how your spine is loaded and how much of a knock-on effect is going to have. Some of the positions, so for example, if you are, so again, this is where the desk setup and how you're sat is important, because if you imagine if you're sat on your desk and you have all your essential stuff on the side and you're having to twist your trunk to reach out to these things, that's going to cause a loading through the disc, so that will cause the discs to compress on one side. Which will then affect the nerve roots because the space around it will be slightly narrowed. There's a lot of things that can cause your back pain. So it could just be an incident. So you could hurt your back. Like I said, some of the repetitive movements you can do is bending, twisting, lifting things, lifting heavy objects, or it could be a gradual onset. And by gradual onset, I mean like prolonged sitting for long periods of time. And sometimes when you're sat at your desk, you actually forget to get up and move around. Now, how many of you would admit to the fact that you do that? Self just sat down and not move at all?
Yes.
Yes, definitely.
Yeah, definitely. And do you find when you're sat down, you find that when you sometimes get up, you get that ache as you get up?
Sometimes, yeah.
And do you kind of when you have these things, you attribute it to the fact the way you're sitting? So I'm guessing a lot of you are now having to work from home. Is that correct?
Yes, that's right.
Yeah. So do you all have a proper desk setup at home, or have you tried to make a proper desk setup at home, or do you find it's not actually ideal?
It's not ideal.
It's not ideal. And do you find you're having to work from, like, I don't know, your laptop on a sofa, or just using the dining table at the moment?
Yeah. Mixture, yeah.
A mixture of the two. I have had some people say that they have literally they're wherever, because they don't have a proper desk setup, so it's wherever they can find a space. So it could be on the sofa, it could be on the dining table, it's literally on their lap, sat on the floor, and all of these things. You'll find that even if for those that have not ever had any back problems or neck problems, you'll find that you're starting to find these niggles that are attributing to your pain and aches that you may not have experienced before. And that's all because of, coming back to the repetitive strain and being in an uncomfortable position for long periods of time. And that long periods of time sitting, it's what causes the back pain. And for those who haven't actually had any troubles with back, even they will suffer from, repetitive strain and muscular strains. And that causes inflammation in your back, and you end up with muscular spasms, which can sometimes ease depending on what type of activity you've been doing and how long you've been in that position. Sometimes you'll find it eases really quickly. Other times it can take a day or two. It's the build-up of the gradual discomfort, because your back actually is designed for movement, and if you're rigid in one position, then that causes that stiffness. So coming back to the vertebrae that we were talking about, so again, these things will have these discs, they get dehydrated, and you'll find most of you, if you're working from home or even when you were in the office, you'll find that you can't actually move around much, which means that these discs here, because they're quite lubricated and they're full of fluid, they need that fluid to keep them moving. And you'll find that if you're not moving enough, that fluid doesn't get pushed around. So these discs start becoming dehydrated, which means they become quite brittle. And that sometimes is another cause of that stiffness and pain over time, because they get inflamed and irritated, and the disc starts dehydrating, which then causes a lot of pain. And you'll find that a lot of the people will suffer from, so there's about 8 in every 10 people in the UK that get affected by back pain some point in their lives, whether that's due to work or injuries or anything relating to that. So how can you prevent back pain then? So these would be my top tips to prevent your back pain. So first of most would be you avoid prolonged sitting. You stay active. You take regular back exercises and stretches, and you're aware of your posture. You choose the right mattress, and obviously doing the activity will help keep you at bay of overweight and any health risks related to being overweight. And by relax and stay positive, it's the outlook of how you look at things and how you address those matters. So looking into details of avoid prolonged sitting. So by that I mean, it's the most important thing you can do is to keep mobile, because actually resting for long periods of time is likely to make the pain worse. And actually the research shows that bed rest for more than a couple of days doesn't actually help your back pain, and in long term it actually makes it worse. As the muscles in your back become weaker and you become less fit. So sitting down, actually, you're putting your health at risks, and studies have linked sitting down for too long, linked to being inactive with overweight and obesity, type 2 diabetes, some types of cancer, and even early death. So sitting for long periods, it slows your metabolism, which then affects your body's ability to regulate blood sugar levels. It affects your blood pressure, and the breakdown of body fat is slows down. So it's actually knock-on effect on prolonged sitting. So the guidance is to actually move around. And do you know how often you should be moving? Yeah, so every 20 to 30 minutes you should be moving, and you should be moving for about a minute or two. So things that you can do around, so when you are going out to, to workplace, obviously just making sure that you're, parking a little bit away from your location, so you can, that includes a little bit of walk. when you're at home, make an excuse to get up and make a cup of tea or coffee, or if you're in the office, obviously try and get up and take these regular breaks to get up, make a cup of tea or coffee for yourself, for your colleagues, and going to the printer, or even like going up the stairs or walking up the escalators rather than using the lifts. And setting a reminder I think is a good one. So a lot of people, like I said earlier, forget to take a break when they sat down. So if you set a reminder for every 30 minutes, even if you have to stand up at your desk, or even if you're working from home, just put your laptop down, just get up and have a little walk around the room and come back and sit down. It's anything to distract you from that prolonged sitting period. It's not just for your back, it's also for your eyes as well. So constant staring at the screen, it's also causing that strain on your eyes. And I don't know how many of you are already suffering, but you'll find that you're actually experiencing a lot of headaches, you're experiencing some visual disturbances, you're getting drier eyes. It's all of that strain staring at the screen, because we're not only staring at your screen for work, we also have other gadgets that we use, like mobile phones, for example. So whilst you're working, you're also utilizing other gadgets, so the eye strain is actually twice as much. And I'm not sure if any of you are aware, but there's actually this new diagnosis of text neck, and that's also referred to the way people utilize the gadgets, the digital things that we have. So using your mobile phone with your head down, that's extra added strain on your neck and your back, as well as your strain from sitting down whilst working. A lot of you obviously working from home, so you don't have a proper desk setup, so you don't have a computer, a PC. Most of you are using your laptop, so it's important that you set up your desk properly, and maybe using your laptop on a box or something similar, so that you can actually work at an eye level. Maybe standing up every now and then, using the kitchen worktop, so you can work from as if it's a sit-stand desk. So all of these things that you can change around the house as well to help you with that. In taking a phone call, instead of sitting down and taking a phone call, you could have a little walk around, have a stroll around the house whilst you're on the phone, talking to someone, taking regular coffee breaks, tea breaks, loo breaks, and instead of sitting down then in the evening to watch TV, have some active tasks that you can do instead. So anything that's going to keep you active. Actually, research suggests that you should be doing between 75 to 150 minutes of regular exercise a week, and that 75 minutes is if you're doing high intensity exercise, and 150 minutes of moderate exercise. Now, how many of you are doing regular activities outside of work?
Yeah.
Okay.
Yes.
And what sort of activities would those be?
Swimming, spin.
Yeah. So actually swimming, walking and swimming are the best exercises that you can do. Walking is one of the best exercise you can do. So, whilst you're at home, just make sure you set into your routine. Maybe take a 20-minute walk after your lunch break before you come back into work again. Swimming is a very good exercise that you can kind of build into your daily routines. Yoga and Pilates, you can do those from home. There's a lot of virtual classes that are being offered that you could actually put that into your routines of trying to do those as well. You can do lots of other activities at home. So there's a lot of classes that you can join, and you could be working from home. Go up and down your stairs, and actually stair climbing burns more calories per minute than jogging, and counts towards your recommended 150 minutes of your weekly exercise. So that's cardiovascular system you're utilizing and working through that. So regularly walking up your stairs is good for your stronger bones, is good for your cardiovascular fitness, but also for weight management, and it's a safer way of doing it. your back exercises and stretches. So again, that's to help keep your back strong. Your exercise actually also releases endorphins, which is body's natural painkiller. So it keeps the muscles around the spine strong. It provides you with more support to the bones and joints and takes the pressure off of them. Continue to do regular back exercise. And I think most of the people, the problem I find with people is they stop the exercise when they feel better or when the pain is gone. How many put your hands up to that?
Yeah.
Yeah, so when it's human nature, isn't it? When you find that actually we feel better, we don't need to do any more exercises, or I feel quite flexible, I don't feel so much stiffer now, we don't need to do these regular exercises anymore, and until bang, it happens, and then you start the exercises. And I always believe in prevention is better than cure. So if you can prevent that happening in the first place, then why not avoid that injury or that that back going in the first place if you can continue with the regular exercises. And I have got, towards the end of the presentation, I have got some exercises that I put together that I think might be useful for you to do them at your desk. So actually you can do them throughout the day as well. Now, mind your posture, that's a big one. So a lot of you bend, twist, lift in all sorts of awkward positions. When you are sitting down, you use your computers, your tablets, or watching TV. All of these things, you're not actually minding your posture. And actually half of the people in the UK, they suffer from back or neck pain just from poor posture. And it's good to maintain and have a good posture just to keep your pain at bay. And you don't actually realize having a straighter spine is more achievable than you actually think. A lot of you people are hunched over your spine when you're using your computers or your laptops or mobile phones, and it's having that balance of having the correct posture. And I have got some pictures which I'll show you in a moment of how you can have a correct posture without straining your back. And again, mattress, some of you may or may not realize that actually mattress plays a important part in any of your back issues. Sometimes you find that you can't have a restful sleep, which again has a knock-on effect. So if you don't have a good night's sleep and your back isn't supported whilst you are sleeping, you're actually putting an extra strain on your back, which you will wake up with, and you'll have that to start off with already strain on your spine, and then you will have that for the rest of the day. And then during the day, if you then sit in a poor posture with poor ergonomics, that back is actually going to suffer a lot more. So having the right mattress is important for a rested night's sleep, which will then have a better start of the day and more support for your spine as well. Your overweight and health risk, like I already talked about, so that's obviously linked to a lot of the conditions that people can suffer from, so like diabetes most often, and high blood pressure and things. So it's all of the things where the blood isn't actually pushing around. So some of the people in severe cases, you can actually end up with things like DVTs because the blood isn't pushing around the body as much as it would otherwise. So staying positive, so it's important that you have a positive outlook towards things, making sure that you take regular breaks, you relax yourself as well, and not overworking all the time, and staying positive about whatever the circumstances, whatever the situation may be, to try and keep you going. So if we look at posture then, so have a look at this posture. How many of you can relate to some of these pictures here?
Yeah.
Yeah, so there's lots of different postures like I talked about. So, there's, so this is obviously your normal posture. As you can see, you've got, so your spine, as you saw in the very initial picture that I showed you, is a subtle S-shaped curvature. And this is how your posture should be. As you can see, your ears are in line with your shoulders, your hips are in line with your shoulders, and everything runs in that neutral parallel region. So if I was to draw a plumb line, all these points match with each other. if we come to this posture here, this is obviously referred to as your flat back curvature. So as you can see, the spine is quite straight. That curvature, that natural subtle curvature that should be there, is no longer there. And then you end up sticking your back out and having your knees locked in place. So that obviously is to prevent you from obviously tipping forwards. But then that is causing, as you can already see, puts that pressure through that spine. Can you all see that? Looking at this one, so this is your arched back or bridge posture. So as you can see, your back is quite straight, but then you've got hyperextended back here. So compared to this curvature here, this curvature is a lot more. So what will happen to the, so if you go back or reflect on or remember the picture that I showed you initially, this is going to load a lot through your discs and your spine in the lower part of your spine. And if you imagine sitting in that position, is your back is going to be supported against a chair when you sit in that position? No, it's not, is it? It's going to load a lot through the spine. So even when you're stood up, you can see the amount of pressure that's having to go through and having to compensate so that you're not tipping forward in that position. It puts a lot more pressure through your spine. This position here, so it's the leaning tower where your head leans forward in order to support the spine. So again, you've lost that natural curvature there. You're actually leaning forward, which then puts that pressure. So sometimes you'll see people referring to as your forward head carriage or having your head slightly forward. So it's no longer in line with your spine. So these people with this, as you can see, a slight what we call the kyphosis or the upper body curvature. A lot of people will suffer from neck and upper back problems, as well as lower back, which is obviously your compensatory effect around that. And then I'm sure some of you can relate to this posture, very common posture to have, where you have rounded shoulders. A lot of people I see actually, they present with this sort of posture. So this one and this one is the most common posture, poor posture ergonomics that I see, where you have your head, rounded shoulders, your head sticking out, and again, increased kyphosis, so a lot of curvature on the top of the spine here, which again will lead to a lot of the problems around the neck and the upper back area. And again, some people may also have a lot of headaches as well. And then you get your back problems as a knock-on effect from this curvature here. Does that all make sense so far?
Yeah. Yes, thank you.
Okay. So moving on to then the poor posture and ergonomics. So again, this is what I was referring to, and I'm sure a lot of you are going to put your hands up and they are going to relate to this posture, all of these here. So slouching, hunching, straddling the phone, and the poking chin. So a lot of you, when you sit, even when you do have a proper desk setup, I can appreciate you don't have a proper desk setup at home, but even when you are at home, or when you are at work, a lot of you, despite the fact you do have a proper desk setup, you do slouch. So slouching, it doesn't, it's not always causes discomfort, but over time, because this is your comfort posture, isn't it? So you can see here, you've got a lot of gap between the back seat and your lower back. So your lower back isn't actually supported. And in this case, none of your spine is supported. And how curved your spine is when you're leaning over that desk here or your laptop and you're working. So you can imagine the amount of load that takes place through this here, through the spine, and your vertebrae are going to be compressed, aren't they? Because there's a lot of pressure that goes through, and then your head falls forward, so it kind of goes into that poking chin position almost, where you're kind of loading through your neck, and then no wonder you experience neck and back pain because of the pressure around here. So, you get all of these pressure, but not only your spine, we're not just looking at your musculoskeletal system, but coming back to your organs. So your internal organs will get compressed and have problems. So you can imagine your chest. So because you've got rounded shoulders here, you are compressing your chest. So that's going to affect your breathing over time. You are compressing your organs, so your stomach, so this is where, we talked about the metabolism. So everything is all kind of coiled up in here. So there's nothing stretches it out to allow for that fluid to run through back and forth. So over time, this position can put a lot of strain and on already sensitized muscles and your soft tissues as well. And that causes tension, increases tension in your muscles, which may then obviously over time cause pain. So it's important to get into the habit of sitting correctly. It may not feel comfortable. If this is your comfortable position, then sitting upright may not feel comfortable initially, but actually over time, this is what is going to benefit your muscles and support you in your correct positions. And the exercises that I would recommend to correct this sort of posture is things like bridges, back extensions, and plank. How many are you aware of the exercises that I've just mentioned?
Yes.
Yeah, so these are these are a lot of the strengthening exercises. So bridges is basically just where you're on your back and you just raise your pelvis with your knees bent. Your back extension, so again you're on your front and just extending your back, and your plank, as the name suggests, you're literally on your elbows and on your toes, and you're lifting your trunk up to support that. So all of these will help correct this position here. Coming down to hunching, and again, as you, most of you can relate to the hunching as well, and you can see these are the areas where the more strain is most likely to happen. So what we call the pivot points, or the most increased risk areas of the spine, where you're going to get a lot of tension and strain around these areas here. So staring at the screen, you're almost, again, there's a lot more compression around your organs as well as your spine compared to this position here. So again, hunching over your keyboard is usually a sign that your chest is quite tight and you have an upper weak back, which prevents you from sitting upright. So you automatically fall into that position here. And this type of posture obviously can contribute to developing a rounded upper back, which then causes shoulder and upper back stiffness, which most of you can relate to. When you hunch over a computer, your head tends to lean forward, you lead to a poor posture, and you have similar problems when you're using a phone, which, like I referred to before, is referred to as the text neck. So some of the upper back, neck, and rare shoulder exercise strengthenings can include things like chest stretches, neck postures, and that will help correct your hunched back and your neck. So for example, you kind of gently lengthen your neck upwards, so your chin is tucked in. You can do the seated rows or pull-ups and the chest stretches. Some of these stretches I have included on the last slide as well, just to kind of help you see what they actually look like. Poking chin. So again, as you can see, so this is what should your ideal posture be, and this is the chronic neck forward head carriage posture. So as you can see, these are the muscles and the spine area which gets affected. So here you've got your muscle nice and relaxed, and here you've got an overstretched muscle which then pulls on your spine and causes unnecessary strain. So again, that posture is affected by sitting too long in one position. Your computer screen is too low or too high, and then your back is hunched, or a combination of all three of those that can cause a poking chin. So correcting that chin posture will involve improving your sitting habits. You exercise to correct your posture, and it would be things like lengthening your neck upwards as you tuck your chin in, bring your shoulder blades down and back. So you should always make sure your shoulders are down and back towards your spine. You can pull in your lower tummy muscles to maintain a natural curve in your lower back, and just adjust your seating as well to make sure your screen isn't too high or too low. The last one, the straddling phone, and again, a lot of you can relate to that. You're trying to multitask, so you've got your phone in one ear, between your ear and your shoulder, and you're typing away as you are utilizing that. So it's basically, it causes a lot of strain, as you can imagine. So if you were to bend this neck on this width, you can imagine that's going to load your discs, and it's going to compress all of these disc areas on that side of the neck and shoulder where you're putting the phone in between. And that's going to put a lot of strain on your muscles of the neck, your upper back and your shoulder. So as this shoulder comes down, this shoulder will automatically rise up to compensate for this. So again, you're going to get that imbalance between the shoulders. So you'll probably, sometimes you see how one shoulder sits slightly higher than the other, and that's because you're encouraging this shoulder to always be down and this shoulder to be always up. And as you're typing away, that's going to change the angle at which you change as well. So your eyes aren't going to be level with your screen, which is going to have a knock-on effect onto your, the screen as well. So you're going to end up with the poking chin almost as well, because you're going to have that knock-on effect around the area as well. And that's going to, again, your shoulders and your necks aren't designed to be in that position for length of time. So over time, this is going to put a lot of strain on your muscles and your other soft tissues, and lead to muscle imbalance, which I've said, between your left and your right side of the neck, and also shoulders. So, to fix that, obviously get a headset, so you're using hands-free devices to prevent that neck stiffness and pain over time. You can do the stretches you can do would be your chest stretches, your neck stretches, so that would be gently stretching your neck side to side, so you're lengthening this side of the muscle, because as you can imagine, this side of the muscle is going to be tight and short. So you want to stretch the neck out to the side so you can lengthen this muscle again, and trying to hold it for maybe 5 to 10 seconds to try and then do a few repetitions on each side. You can also do neck rotation, so looking over your shoulder side to side, again, to try and lengthen these muscles and try and get a bit more mobility through the neck as well. It can affect not only your musculoskeletal system, but also your organs as well. So things like, because of having a tight chest, you're going to probably end up with having difficulty breathing. You're going to have an eye strain, and you're going to have a compression on your internal organs. You're going to have impaired blood circulation, because you're in that position for such a long time. The blood is not going to have enough, pumping to push against opposite the blood flow. It's going to overall affect your heart, because your sedentary lifestyle will contribute to cardiovascular disease, and affect your sleep as well. It's going to have effects on your stomach, so type 2 diabetes, and also obviously the musculoskeletal problems of headaches, neck and shoulder pain, and lower back pain as well. So just to kind of help you visualize what should the correct and incorrect posture should be. So this is obviously incorrect posture, as you can see, and this is how you should be sitting. So it's important that whether you're using working from home or whether you have a desk setup at work, everything should be how in the correct alignment. And I've just put in some notes there for you as to what you should be. So basically, you're aiming for your elbows and arms to be resting on your armchair or your armrest or your desk. You're aiming for your buttocks to be touching the back of the chair, so you're supporting the whole of the back, and your feet should be firmly on the floor. Now, if you find that you can't get your feet flat on the floor, you can always get something. So if you're at home, maybe use a footstool. If you're at work, you can get footrests. And obviously at work, there's a lot of things that can be made available to you. But if you're at home, you've got to, make use of what you have at home. So things like foot paddles or footstools around the house. You could use like a coffee table. There are things, actually, I'm not sure if you guys have seen it, but some of the things that I've recommended to a few of my patients now, it's so the feeding trays that they have in the hospitals, I'm not sure if you've come across those, but these feeding trays, they actually slide into the, if they have a feet, then they slide into the, under the table or under the bed or sofa or whatever you're utilizing. And they are adjustable height, so you can actually put your laptop on those. And that's worth investing into if you're having to work from. And I think you're going to be working from home for a little while now. So it's utilizing the to the stuff that you have around the house. And I think that's a good investment to have it around the house to try and work the best you can. Looking at the posture, so what sort of things you find around the house difficult when you're setting up your posture? Are there particular things you're finding it difficult?
I just wanted to say that my arm, the wrists, back in the office, you can get the wrist pad thing, jigs that you put on your desk. And obviously we don't have that set up at home. So I know you've said about foot rests, but for your wrists, what do you do? Roll up a towel, or what's the right thing to do, really?
Yeah, so you can. So obviously you can still request, even though you're not at home in the office. I think you can still ask for work to provide you with those, so that you can still have it at home. But if you didn't, you can use a rolled up towel to put in there, just to kind of support your wrist, so your wrist is that, because what happens is when your wrist is in that flexed position, all you're doing is obviously you want to prevent from carpal tunnel syndrome. So having the wrist up slightly on an object, it just kind of helps. So rolled up towel in the meanwhile. But I think if you ask your HR, they should be able to provide you with the wrist support even around the house as well.
Okay.
How do you see supporting your wrists if you're trying to elevate your laptop? Because obviously the keyboard is then too high for you to type at a natural angle.
Yeah, so this is why I would suggest having a separate keyboard and a mouse.
Right. Okay.
Yeah, so it's a laptops. I have got a slide in there for laptops. Laptops are great. They allow flexibility and everything, but actually when it comes to working, they're not good for your posture or your ergonomics. So I would suggest having a separate keyboard and a mouse. And so I've put another slide in. So and this obviously tells you about your laptops as well. So I would suggest adjusting your chair. So if you're at home, just maybe using a cushion behind your back, just to bridge any gap between your chair and your back, so that your lower back is supported. And adjusting your chair, obviously at work, you have good chairs, so they're adjustable heights. But if you find that your chair at home isn't doing that, then obviously you can use cushions underneath as well to try and get that the correct height of the chair as well. Your knees should be slightly, so when you're sat down, your knees should be slightly lower than your hips. And like I said before, you can use a footrest if necessary. So see that right angle here, and your back supported. So if needed, you could actually use a cushion there. And if you did have a laptop, I would suggest having a separate keyboard and a mouse pad as well, just to kind of try and get this angle right, and try to work through, at home, trying to get as much things done at home to have the closest to a good setup around the house as well. You should have your feet rested on the floor. If you can't, then obviously using the footrest, your screen should be at an eye level. So again, if you're using a laptop, then raising it on a surface or on a box, just so that your screen is at an eye level is ideally. So you should leave a gap of about 4 to 6 inches at the front of the desk to rest your wrists between, when you're typing, keeping your arms bent in an L-shaped, so that your elbows are by your side. You should use your wrist and sometimes, at the level of the keys as well. Keep your mouse closer to you, so position your mouse so it is as close to you as possible. A mouse mat, like I said, with a wrist pad will help your wrist straight and avoid that awkward bending. But in the meanwhile, like I said, you could use a rolled up towel or something of that sort. But you should be able to get some of that equipment delivered sent to you at home if you are having to work from home for long periods of time. And the other thing I've obviously when you're at work, you have the screen glare free as possible, but obviously at home, I'm not sure if you have similar similar sort of stuff. But again, if you have a glare on your screen, that can have a knock-on effect on your eye strain as well. So I would position your monitor so you can avoid that reflection from overhead lighting or sunlight. If necessary, obviously draw the curtains or pull the blinds so that you can adjust the screen's brightness or contrast as well to avoid that screen glare, which is going to cause that eye strain as well. And if you wear glasses, I'm not sure if you're already aware, but bifocals, they're not ideal actually for computer work. So because you should be able to see the screen easily without having to raise or lower your head. But with bifocals, you'll find that you're constantly having to move your head, which obviously isn't going to help with your neck and your joints. And if you can't work comfortably with your bifocals, then different spectacles ideally. But again, that's you can discuss that with your opticians as well. You should have, so as I was mentioning, in the beginning, you should have everything, all the objects that you need, like telephones, staplers, notepads, pens, papers, whatever you need in your easy reach. So you're not bending and twisting awkwardly to get to those things. Always turn your chair to face the object rather than twisting to pick up stuff. And then again, avoiding the phone strain. So try not to hold your phone in between your ears and your shoulder, and trying to get a hands-free device so that you can have your neck muscles strain less, basically. Taking regular breaks, so again, putting reminders in your phone or on your computer to help you get up and move around as often as possible, as often as 30 minutes, but maximum 45 minutes if you're going to push it, or 60 minutes, because prolonged sitting is going to have a knock-on effect over time. I just put this in to kind of help you see this type of activities that you can do to help keep you moving around. So like I was saying initially, if you're doing a vigorous type of exercise, then 75 minutes. And by vigorous exercise, they mean you're breathing fast because you're using your cardiovascular system, and your ability to talk becomes difficult. Your 150 minutes is your moderate exercise, where you have an increased breathing, but you're still able to talk. But some people find mixture of the two is helpful. So the physical activity, like I said, overall, it will help reduce risk of cardiovascular disease, depression, type 2 diabetes. And any of these are good, exercises. So yoga, gardening, cycling, swimming, weights, sports, walking, stairs. But any of these activities are good in moderation. So it's not point, swimming every day of the week or doing heavy weights every day of the week, because you're going to end up straining your back. So it's a combination of these things, but according to your own body's ability to do, and always gradually build up. Don't go straight into, doing weights tomorrow if you haven't done any weights at all. It's everything that you do is a gradual build up, and there's less strain. There's exercises which put less strain on you. Also, walking is the best exercise that you can do without unnecessary strain on your joints. Swimming and yoga. Obviously, gardening, when you're doing that, again, be aware of how you're positioning yourself, how you're bending, how you're twisting, and how long you're doing it for. Regular breaks in between is good. Cycling is good, but again, how it has to be a correct height and fitted for you, so you're not, again, compensating for your posture when you're cycling for long periods of time. Sports, again, it depends what kind of sports you're doing. You don't want to end up with sports-related injuries, so everything in moderation. And stairs, so again, like I mentioned initially, stairs is a very good exercise for cardiovascular system, keeping your blood circulating around and getting your heart pumping. So all of these exercises are good, but in moderation and according to your own body's ability. Obviously, if you already have back pain or neck pain or any other health conditions, then you need to choose the right activity that suits you and choose the level that suits you best, because you don't want to end up with other injuries. So So again, so some of the top tips I put in about the screen, which I've already mentioned before. So like checking the angle and the height and the distance of your screen, adjusting the size and the style of the font so you're able to read it, so you're not squinting your eyes to read it, and play around with your settings. So adjust the monitor's color and brightness according to what feels comfortable for you, and things like taking regular breaks, try and alternate between tasks so you're not staring at your screen for too long. So for example, if you're working on your computer screen for the first hour, maybe next hour try and do some paperwork or make some phone calls, non-screen activities at lunchtime. So for example, going out for a walk or making some phone calls, and always go out, take a regular break from your screen. So when you have a lunch, don't try and eat at your desk. I know sometimes when you're at home it's difficult because you think I'll just grab out a sandwich and I can work away. Just make your lunchtime, your time. So take a break, complete break from work, and go and sit somewhere away from your computer screen, and leave the phone as well, because otherwise you'll end up with having the screen from moving from one screen to the other screen. And obviously having your eyes tested regularly, and having these screen settings as well. So it's just anything that's going to help prevent that eye strain, as well as preventing the back and neck strain as well. Right, so stretches then. So these are some of the stretches that I mentioned earlier, and I've just put in some pictures as well as some instructions as to how you can do it. Now, Brugger's posture exercise I find is really effective for all desk workers, because you sit with your shoulders rounded, so you just need to, like I said, open up that chest and try and get as much movement in as possible. So sitting upright and just stretching your arms out to try and open up that chest area. Trunk twists. So again, it's a very useful activity to develop and maintain your flexibility in your upper back. Your side stretches. So again, these muscles around the side get really tight, especially if you're leaning to one side. So this stretch will help release tension in the side muscles and the muscles between your ribs, as well as your shoulders and your triceps. So these muscles here around the arm area. So again, pectoral stretch, which again opens up the chest area. So remember I was talking about hunched back, which causes that tight chest. So this exercise will help allow this opening of that chest area so that you can have more flexibility, more movement around the area. Stretching your hips. So again, when you're sitting down for too long in one position, you'll get really tight hips. So this is to allow for that stretch to take place and open up that hip, but also allow for that stretch in the back as well. A lot of people actually will stretch their arms, will stretch their back, but actually they forget to stretch their wrists. And actually it's the most important thing you want to do, because your wrists are the ones that get really tight because you're typing away and you want to prevent yourself from repetitive carpal tunnel syndrome. So actually stretching the wrist is the key to try and get your flexibility in the wrist and the arm area as well. So again, stretching your back. So when you're sitting in that sort of position, your back gets really tight. So it's called the big hug. And that's to try and allow for that opening of that back muscles to stretch up. Stretching your arms. And then doing your neck movement. So this is the one I was referring to earlier, doing your neck movements, especially if your muscles get really tight around here. So moving your head side to side and then bring your ears to the shoulder to try and get these neck muscles elongated and lengthened around the area. And some core exercises, just some strengthening exercises sitting. So as you can see, all of these stretches actually are useful and you can do them sat down at your desk. You don't actually have to go anywhere. So it actually gives you, so there's no excuse that you shouldn't be able to do these exercises or build into your daily routine, even if you picked one exercise and do it. So, I suggested taking a regular break every half an hour. So there's 8 or 9 exercises. So actually you could get, in an hour, you could get 2 exercises done, if not, so you could actually get 1 to 2 exercises done every hour. And even if you got only 1 exercise done, if you think about it, if you have a 7 hours working day, you can get 7 of these exercises done during the day, which actually, if you worked around all of the muscles, you will be working through your muscles regularly on a daily basis. And that's actually going to help prevent that strain, that tension building up in your muscles and your spine in the first instance. This is it from me. Any questions?
Can I just ask you something quickly, Samira? You said have breaks every half an hour, 45 minutes.
Yeah.
Do you go away for a couple of minutes, 5 minutes, 10 minutes?
I would say, yeah, 1 to 2 minutes.
1 to 2 minutes, okay, because that's quite a lot of breaks. If you, I mean, obviously I don't take as many breaks as that, but if that's wise to do, then obviously it's just moving away for a minute or two, and then
literally you don't need to. So the research suggests it's literally it's to get you away from that screen for a matter of minutes. So even if it's just, like I said earlier, you know, an excuse to get up and have a little walk around to make up a cup of tea, and obviously a cup of tea won't take it will probably take a couple of minutes to make, but you know, every an hour and a half, you could take a little bit longer break, but every half an hour is a minute to 2 minute break.
You said about having a good mattress. What do you define as a good mattress?
So a good mattress, I think everybody will say, you know, they have a different preference, but you know, you don't have to go for a memory foam mattress. Anything, I would say, if you're going to choose a mattress, it has to be like a medium firm. You don't want it too soft and you don't want it too hard. So anything that's going to have is going to have a medium firm. Same with your pillows. If you're going to have pillows, they have to be like a medium firm pillows so that your head is rested on it comfortably, but not rigid and not too soft, so it sinks into the surface.
I'm actually getting pain across my shoulders, the tops of my shoulders, rather than in my back. Is there anything I can do for that, or is there anything that would particularly cause that?
Yeah, so your problem will probably be, so the first initial slides I mentioned where, you know, the upper back problems. So you're probably having the upper back where it is running across the shoulders. So that's probably, you know, over time, if that's something new that you've experienced, that's probably the way you're sitting down. So that's going to be your upper back spine. That's obviously causes strain and a tension in the muscles around it. And that's probably what's causing the pain. So some of these stretches that you see on the slide, that's going to help as well. But you're getting any, I can talk to you afterwards as well if you're getting any headaches and things like that, because there may be more than just that upper across the back pain.
Sorry, just do you recommend any particular way to sleep? So I suffer from a slip disc in my L4, L5,
right.
But I found in recent weeks, no matter what way I'm sleeping, I'm waking up with a crick neck and all across my shoulders, and I'm actually in quite a lot of pain and struggling to sort of get out of bed.
Okay, so when was your slip disc diagnosed?
About 8 weeks ago. This is the second time it's a reoccurring issue.
Right, I see. Okay, so do you normally sleep on your front, on your back, or on your side?
I try to sleep on my side.
Okay. How many pillows do you have under your head?
Well, I changed it recently, so I've got just a flat sort of an orthopedic pillow, but I've also got one of the V-shaped pillows, and I don't know whether actually the V-shaped pillow is causing more issue than good.
Right, okay. So I would suggest probably don't use the V-shaped pillow. Have like a medium firm pillow underneath your head, because you're having problems with your head, obviously suggesting that you're not, your neck and your spine isn't supported or around with the pillow when you're sleeping, which is why you end up with your shoulders and your neck pain. When you are lying down on your shoulders, on your side, try not to lie directly on your shoulders, so try not to lie on your side. Try and have your shoulders squared off, so your head's supported, but your shoulders are kind of opened, and try a pillow in between your knees if you haven't already tried that as well.
Okay, thank you.
No worries.
Position that you're meant to sleep in, because I sleep flat on my front with no pillows. Right,
so you're probably doing more harm to your spine than any benefit. So front sleeping is actually one of the worst sleeping positions for your back. So the best position for your spine is actually a side position. So either in a fetal position or in a recovery position. And then you can put, like I was saying to one of your colleagues earlier, you can put one of the pillows in, very thin pillows in between your knees, because what that does is when you sleep on your side, the tendency is for the top leg to, or the hip to literally roll onto the front. And so you load through the hips. Whereas if you put a pillow in between your legs, it allows that knee to be nice and neutral, so you don't load through the joints as much. And obviously having one pillow or two pillows, but they should be like medium firm thickness rather than too high or too low.
Really helpful.
You're welcome.